Joining today, my name is Letty Perez, and I am the broker account executive here at Pivot Health. And at the end of the presentation, I will have my contact information so that you can not jot it down and reach out to me should you have any questions or need any type of assistance when it comes to the Pivot products. Just a little bit of background on who Pivot Health is. So Pivot Health is not an insurance carrier. We are actually a product development, marketing, and management company. And I share this with you because you want to make sure that your clients, when you sell them Pivot products, they're not going to be telling a provider or a facility that they have Pivot Health insurance, because we are not a carrier. We were founded back in 2015. We actually design products, we bring them to market, and we have insurance carriers that actually insure the products for us. In 2018, we were acquired by healthcare.com, which some of you may be familiar with. They are an insure lead tech company. So you'll see that my email address domain is healthcare.com. Just to give you an idea of what the Pivot Health product portfolio looks like. So our niche products are going to be our short-term medical plans. Of course, short-term medical plans are not going to be available in all states. And in some states, there are going to be some separate rules on how often you can sell a short-term medical plan to a client as a great alternative. Our short-term plans are going to be our niche products, and you're going to have a large variety of options when it comes to the STM plans. We do offer an indemnity or a fixed benefit plan. This plan is a little bit unique in that it can stay on the books through the age of 74 years of age. We also offer a dental and vision product. This is going to be available as a check the box when you're selling a short-term medical plan or a hospital indemnity or our indemnity plan anchor plan, or you can sell it standalone. We also have a supplemental product. This is going to be an accident, critical illness, hospital indemnity, and accidental death and dismemberment product. And this is going to be available as a check the box when selling a short-term medical plan. So I'll be showing that to you here shortly. So the short-term medical plans, like I mentioned, you do have a lot of options when it comes to our STM plans with the Pivot portfolio. We have core plans, which are considered our light short-term medical plans, and I'll be going over that in a little bit more detail. We have our classic plans. These are going to be all open access plans. That means there are no network restrictions whatsoever. And these plans were the original plans that we rolled out with back in 2015. Our Epic plans were the most recent plans we rolled out with, and these are underwritten by a different carrier, and there's going to be two plan designs when it comes to Epic. Then we have our quantum plans. Our quantum plans are quite rich in benefits. They are a PPO plan that utilize a Cigna network. So what makes the Pivot Health short-term medical products unique? So again, I'm going to reiterate that you're going to see when you go into your Pivot agent portal that there's going to be a lot of plan options that are bound to fit your client's needs and budgets. We do offer extended duration. So for those of you who are not familiar with that, what's the benefit of offering a client an extended duration? That means that they're signing up for more than one policy coverage period from the onset, so that you can offer a 2 by 180-day coverage, 2 by 364-day coverage, and 3 by 364-day coverage. There's going to be no additional underwriting, keeping in mind that the eligibility for the short-term medical plans with Pivot is based solely on how they can answer the application questions. There's going to be no new pre-X look back. There's no new waiting periods, and all the benefits, including deductibles, copays, and benefit maximums, start over with each new coverage period. There's going to be no gap in coverage. One policy is going to end at midnight. The next one is automatically going to start at 12:01 a.m. the next day. Nice thing for you guys as the agents, commissions remain level. So there is no reduction in your comp for the second and or third term. Also keep in mind that if the client is on an extended duration plan and they should develop a condition while on the extended duration that would normally make them ineligible to enroll again, that condition would not be considered pre-ex in the subsequent policies. We will have to continue to cover it and until the policies expire. We have now included a preventive and wellness benefit on every plan. That is new as of fourth quarter in 2022. We also have plans that use national networks. We also are known for our open access plans. These plans have no network restrictions. Your client has the freedom to go to any doctor or any facility. As I mentioned, our underwriting is simplified. So based on how your client can answer the application questions, they have to be able to answer no to all the questions in order to qualify for coverage. We have no rate ups, so you're not going to see a tobacco use question on the application. We accept controlled hypertension. We also accept controlled diabetes by diet and exercise only. So therefore, if they are on any type of an oral medication or obviously insulin, they would not be eligible for coverage. We do not ask for a social security number, which means that your client does not have to be a U.S. citizen in order to have coverage. If your client is not a U.S. citizen, they only have to be able to answer that they have resided in the United States for the prior 4 months. With the open access plans, we have offered a patient advocacy service. That patient advocacy service will help your client navigate to find providers and facilities in their area based on the services they need that will work best with the plan. And they also offer bill negotiation services for those out-of-pocket expenses that the client may be responsible for. You want to make sure that you advise your client to use that service. It's at no cost to them. It is a free service and it comes with their open access plans. Also, Pivot is known for designing products for certain niche markets. So for example, we cover student athletes. So high school and college athletes would be covered on our plans. Our child